A very good morning to all of you. Today I'm going to start a new nosode, syphilinum. Uh, Actually, the history of its proving is Lux in 1930 suggested its therapeutic use of syphilinum, means secretion of syphilitic chancre. But it was the Swan who published the first pathogenesis, and source is from chancre of syphilis. Now, if we want to understand syphilinum, the keynote for syphilinum is destruction. So, this is the only stigma which destroy living tissue. Not only soft tissues but also bony tissues. So, syphilinum, the background of syphilinum, the asthmatic background is syphilis. Now, syphilis is the only stigma which can destroy living tissue. Yes, as we know that SORA is responsible for functional dysfunction, psychosis for over and undergrowths, and destruction. Syphilinum is responsible for destruction. So this is the key word to understand syphilinum. Now, history of syphilis. We know that it has three stages. The first, incubation period. There is soreness, then the body rashes appears, and then internal organs get affected. And it can, third stage can appear of 3 to 15 years after initial infection. So any maltreated infection or badly treated syphilis can lead to suppression of syphilinum, and that is the main cause that there is many other symptoms because of the suppression of syphilis. Now, as I have told you, the destruction, the aging process, all are present in syphilitic miasms. So constitution is not an exception. We can also see the constitution of this baby in this picture. It looks like young old. So aging is reflected here with wrinkles on face and foreheads. The eyes are sunken in sockets and protruded frontal eminences, dented teeth, and tibias are like sword blade. So complete aging process could be seen in syphilinum. Yes, aging before age. Now, main seat of action of syphilinum is nerves, long bones, and mucous membrane. So, any neuralgic pain, uh, we can use it in paralysis, in any central nervous system disorder, or any emotional disturbances as well, carries of long bones, or if there is a chronic condition of mucous membranes, means chronic inflammation, then we can use syphilinum. Now, mentals of syphilinum. We find generally this mentals in most of syphilitic remedies. Loss of memory. Loss of memory means the loss of memory word rubric is seen in various medicines, but how we can differentiate it from other, that is very important. Now, here there is intellectual slowness. Okay, it's not his idiotic appearance or like that. Intellectually, he is very slow. There is difficulty in concentration, and they are very indecisive, and there is mental prostration. As such, these 4 points we generally see in aging, during aging. Yes, generally the old people, they are intellectual, a little bit slow. There is difficulty in concentration, and sometimes they are very indecisive. Means the person in 70s and 80s are really very indecisive. So this all aging could be found very early in syphilis patients. Psychomotor problem in children is like there is difficulty in learning mathematics. As you know that right from beginning the brain is not very fully developed. There is aging process, at a very early stage. So they forgot various things, and there is difficulty in learning mathematics, and especially for languages. So calculation is a big problem for this kids. So if there is any complaint from school that the child is unable to calculate, or he is not, there is difficulty in understanding mathematics, we can go for this medicine. Now, another important character is obsession, anxiety, neurosis. So, obsession compulsive disorder, a very important remedy for obsessive compulsive disorder, OCDs. Now, there is a fear of being ruined, fear of incurable diseases, fear of night. Fear of night is generally seen in most of syphilitic remedies, fear of dirt. So they keep, they're very stereotype individuals. They keep on repeating the same gestures, continual repetition of same gestures, same ticks, same words. They wash their hands frequently. Okay, so this is a very important feature which is generally found in OCD. So they wash their hand frequently and verifies whether the doors are locked or not. So a very stereotyped individual. Now, another important mental symptom is they are emotionally disconnected. Now, indifference to loved one is not which we found in Sapia. This is like they are emotionally also not very well developed. So you can say there is a disconnection. They cannot express themselves as emotionally. They are not very strong, and they are not very developed like psoriatic patients. So they are emotionally disconnected, and this indifference could be seen in syphilis. Now, characteristic of this remedy, very important characteristic, all the symptoms are worse at night. Yes, character of syphilitic miasm also. So all syphilitic remedies are worse at night. As you know, generally we have seen in Medurinum that at night they feel better. In evening they feel better. They are night-going people. But just opposite. Here, the syphilitic remedies are generally worse at night. And the fear, the terrific suffering from exhaustion on awakening, and there is a kind of fear because when they wake up, they become very exhausted, even both mentally and physically, and that is also a fear in their mind. That's why they don't like nights. Now, extreme emaciation of the entire body could be seen in syphilitic patients. Yes, the wasting of muscles, again destruction of tissues, wasting of muscles, aging. That's why this is very important for extreme emaciation of entire body. Generally seen, emaciation and wasting of muscles, generally seen in syphilitic remedies. Now, hereditary tendency to alcoholism. If there is syphilitic history or syphilitic background, then we can use this remedy. Like if there is aging process or destructive ulceration or something in history, in family history also, then definitely we can use this remedy. So this desire for alcohol or hereditary tendency could be found in all nosodes. But if the background is syphilitic, then only we can use this remedy. Yes, very important characteristic. Another important characteristic of this remedy is the infants begin to cry immediately after birth. And okay, so of course it's a good sign. The infants must cry immediately after birth, but they cry whole night. They don't sleep at all. You have tried many medicine, but still it's not working, and they keep on crying. They keep on crying. Then we can think of syphilitic miasm, because generally syphilitic miasms, they are worse at night. That's why. Now, another important characteristic is their discharge. As we have seen, the action is also in mucous membrane. So this discharge is profuse. Yes, profuseness of all the discharge, and generally they are acrid. There is burning. So acrid discharges are seen in syphilitic patients. Acrid echorious nasal discharge, excoriating inside of nose, and upper lip. Now, headache is generally this neuralgic in character. They are deep-seated with sleeplessness. The nights, generally, aggravation is at night, so there is sleeplessness. Now, mortality is generally, as I have told you, that this headache starts at 4 p.m. means evening, worse at 10 to 11, and they are ameliorated in during daytime. Now, falling of hairs, again destruction, aging, that falls in bunches, graying of hairs at very early age. Now, eyes, as we all know, the seat of action is nervous system. So, strabismus, diplopia, one may seen below the other. Now, it's a very important again remedy for recurrent inflammation of cornea or iritis if there is history of maltreated or suppressed syphilis. Now, paralysis of eye muscles, yes. So, paralysis of eye muscles or ptosis could be also seen in this remedy. Now, caries of nasal bone. So, very important remedy, as I told you, that destruction not only of tissues but destruction of bones could be seen in syphilitic miasm, especially in syphilinum. So, caries of nasal bone or any deformity, if there is perforation of palate, then we can think of syphilinum. A burning coryza, acrid coryza with yellowish, greenish, and irritating discharge. So, generally we use it in chronic inflammation. So, it has effect in mucous membrane, but in chronic affections, in chronic inflammation, not in acute inflammation. Now, chronic otalgia, especially right-sided with purulent otorrhea. Now here there could be caries of bones of inner ear. So progressive deafness because of this caries of bones. Then also syphilis. Syphilinum is a good medicine. Now this teeth, irregular teeth are very important. You can see that this indented teeth, these are especially known as very special Hutchinson teeth. Yes, so Hutchinson teeth is an important character of syphilinum patients. Now, teeth decay at edges. It's also present in Staphy sagria, but here it is typical Hutchinson teeth. You can notice this, the teeth are irregular and they are indented, they are small. Cracking in fissures, again syphilitic character, destruction. Okay, so you can see the tongue, yes, and deep longitudinal cracks, the tongue is coated or again burning in tongue. So burning is very important character of syphilitic miasm. You will find generally burning all over, burning. So that is important characteristic of syphilitic miasm also. Now, excessive flow of saliva, this runs out of mouth while sleeping and there is fetid breath. Now, it's a very important remedy for anorectal strictures. So, anorectal strictures, if there is any ulceration, yes, again destruction. Very important. Syphilinum is a very important nosode for ulceration. Now, anal fissures or rectal paresis, perianal ulceration with painful fissures. So this painful, they are very painful, bleeding easily and discharging of pus. So, such a chronic condition. There could be rectal paresis as well as ulceration, painful fissures, very bad condition. So that is the reason that it could lead to chronic stubborn constipation, maybe because of a structure or maybe because of fissure. Even enemas are very painful. So if there is chronic stubborn constipation in an emaciated subject or in an emaciated patient, you can give this medicine. Suppose you have tried many medicine for constipation, you have given silicea, you have given many other drugs and they are not working. Even you have tried opium and all that, they are not working. If the reason is rectal paresis or there is any rectal stricture, then we can go for syphilinum. It has a very important character in cardiovascular system, very important. Lancinating pain. Lancinating pain from base of heart to apex at night. So you can see that from base to apex is syphilinum, from apex to base is medurinum, and from base to shoulder is spigelia. Now again, pulsation of hot blood flowing in arteries, and that's why again it gives a burning sensation to the patient. Okay, so burning is a very important characteristic of syphilinum. Now, these patients are very prone to ulcerative process, destructive process, aging process. So, ulceration of vocal cord could be seen. Then, very painful sensitiveness of larynx, acute laryngeal pain, generally at night, and it compels the patient to get out of bed and walk in the room. Uh, a very important character of syphilinum, again, one important character is aphonia. Aphonia, especially in women before menses, very important character of this remedy. Yes, so aphonia before menses. It's a good medicine for asthma also in hot and humid weather in summer, especially in summer and in hot and humid weather. Now, generally the cough is dry, tearing cough. The patient wakes up between 1 to 4 a.m. They cannot lie on right side, and generally this cough gets aggravated before a storm. It's a clear aggravation before a storm. So night cough, a very important remedy for night cough, chronic cough. As I told you, profuseness of discharge could be seen, lots of infections could be seen in this medicine, chronic inflammation could be seen in this medicine. So abundant leukorrhea, it may flow along the thigh, thick, irritating, greenish, worse at night with lumbar pain. So, profuse leukorrhea, and it suggests it may be because of chronic vaginitis or maybe because of some infection. It's not physiological, which we found in psoriatic medicine. It's infectious leukorrhea, very chronic kind of infection. Now, in extremities, as we know that it's a very important remedy which has action on long bones, but this remedy, this syphilinum, has a very peculiar symptom, like it has action on deltoid muscle. So, and this rheumatism of the shoulder joint at the insertion of deltoid, which is aggravated at night by raising the hands. So generally aggravation at night, and if it is in shoulder joint where there is insertion of deltoid, you can see here in this picture. Okay, then we can think of this remedy. Now, as I told you, it has effect on long bones. So bone pains of tibia, especially at night, the tibias are very painful. Okay, painful contractions of tendons and muscles of legs, or and they draw especially at night. And night aggravation should be there always. Always there should be night aggravation, and that's where the patient becomes very restless. He gets out of bed and they walk in room. They become restless because of this pain. They cannot sleep. This rigidness and coldness of the extremities could be also found in this remedy. Now, all syphilitic remedies, they have tendency for abscesses. So abscess with fetid discharge, the pustular eruptions of the skin, brown, reddish with coppery spots, macule ulceration and induration of skin, ulceration of mouth, ulceration of the skin. This syphilinum is a wonderful remedy for abscess, long-standing abscess, which is not healing properly. So, if as an intercurrent also you can use this nosode. Now, modalities, as I told you, very important aggravation is at night, bad touch, and again seaside aggravation is there. Okay, again, there is seaside aggravation, and during storm there is clear-cut aggravation and amelioration during the day by slow walk on mountains. So, generally, it affects the right side of the patient. Okay, now this was about syphilinum. Thank you very much.